Today's milestone celebration shines a spotlight on our institute's important mission to use advanced computing to improve the well-being and quality of life, to diminish disease, and to enhance outcomes for everyone across the state of Maryland and beyond. This institute is a landmark investment by the county and the state, creating research and discoveries that will be rapidly translated into practice, as well as spurring economic development for Montgomery County. Our institute's researchers are redefining the state of the art in applied artificial intelligence, bioinformatics, and immersive visualization, and they're applying these breakthroughs to improve health through real-world evidence and adaptive clinical trials, through data-driven population health, and through therapeutic drug discovery. And I can say without exaggeration that the future of health is being developed right here in North Bethesda.
Through our partnerships with companies and federal agencies, we are innovating in healthcare delivery and accelerating economic development in Montgomery County. It's been wonderful that the local life sciences community has been so welcoming and eager to partner with our institute.
The partnership with the University of Maryland Medical System, with the computational scientists from College Park and the biologic medical scientists from UMB is just an incredible three-part, collaboration. What it allows us is to use data that's HIPAA protected, encrypted, or de-identified for patient safety, but data from 2 million patients across the state of Maryland that are seen at the University of Maryland Medical System. And using that data and then artificial intelligence programming to search and look for patterns in that data, it allows us to reach out and identify individuals that are at risk, for example, at risk of developing kidney disease, at risk for developing heart disease. Can we use that data to sort of survey 2 million people and maybe a change happen that wouldn't be identified by a doctor in clinic, that could be picked up by a system that wouldn't sleep, that uses advanced mathematics, and to really change the outcomes for that patient.
We have the right kind of mathematics to know the exact number of cameras and the placement of the cameras that we need in order to get a really high quality photorealistic 3D representation of a physical object. Now it could be a cell, it could be an organ like you see here, or it could be a physical structure like an operating room. Right? But when we can capture those images, we can then translate those images into what we call a digital twin, an in-computer model of the thing that we care about. And once it's a digital model, then we can do all kinds of things to it, right? We can ask what-if questions. We can practice. We can look at it from different perspectives. So, for example, the beating heart model that you see here now, we imagine that a medical surgeon, for example, might look at that heart model and say, I need to do a certain kind of surgery. Let me plan that out here inside the computer. And then when I have to do it in real life, I'll be better at it, right? So you might even think of like a flight simulator.
There's an incredible opportunity in medical education to be in the operating room. Imagine having surgeons at shock trauma at the University of Maryland Medical Center that are assisting a trauma case in another country, like in Mexico or in Pakistan, and actually operating together. So there's immense opportunities for medical education and patient care in this space.
3, 2, 1. Welcome to the home of the University of Maryland Institute for Health Computing.